holistic registered dietitian, environmental nutritionist, and we are Married to Health. So Married to Health is our private practice. And you are probably following us on Married to Health on Instagram. We're also streaming this on YouTube and Twitch, so you can follow us everywhere. If you Google Married to Health, will pop up.
Yes. And you might be following us because you recognize we specialize in gut health for adults and kids. We specialize also in plant-based diets for better gut health.
Right.
And if you're new here, welcome. We are loving connecting with all of you so much. We love sharing different types of information. If you couldn't tell, we aren't your average bears. So we like to share our perspective from a plant-based family who not only works with people with gut health issues every day. I've overcome my own gut health issues, and we are raising a daughter, almost 6, who has great gut health.
Yeah, she has wonderful gut health. So we're excited, guys. There's a lot going on. We haven't done a live in a while. We haven't really been too active on Instagram and on all our platforms, but we've been working behind the scenes. There's been a lot going on. We're really excited. We just want to share some updates. So if you're a current patient, we wanted to give updates. And if you're thinking about becoming a patient, or if you just want more information, want to answer some of your questions, just go live, say hi to everyone. I see everyone coming on. That's great.
Hi from Ireland. We have people all around the world who are joining us. Love it. And if you have seen me as a patient before, make sure you check your email. You might have received an important update in there. I want to make sure that I can stay in touch with you to the best of my ability. So check that email. And if there is any action that you want to take, you absolutely can. We absolutely love the great questions that we receive from you guys. We get questions on various topics within gut health, plant-based nutrition for adults and kids for better gut health. And we always let you all know, we love to answer broad questions. We will give you our perspective, our expertise. We can't give medical advice here or any medical nutrition therapy advice here on Instagram, but just want to let you know that if you ever thought about yourself making a visit, a family member making a visit, you all are so sweet. You're always thinking about my mom this, my husband that, my kids this. We just want to let you know we're here to support you. So if you ever did want to see me for a visit, you can absolutely do so. We are so excited. James has been working hard with our team on our website, and we have some great updates for you.
Yeah, guys. So if you go to marriedtohealth.com, we really wanted to just spruce things up for you guys there. We have a how it works page, so it'll walk you through everything. So all of your insurance questions, all of your, like, what if I don't have insurance? How do I do this? Signing up for our portal. So I have a really cool portal. Like, what about the labs I did? I did SIBO breath test. I did a NutriVal. I did, there's so much testing out there. What about all my supplements I'm taking and my medication? So really, we try to make it easy for you. We have a portal where it connects you to everything, where you can upload everything. And it's as easy as just remembering your login information like you do for other applications. So we have that integrated into our website. So we're making it much easier for our patients. We're making it easier for you to navigate that. And we do accept insurance. So we do accept PPO insurance as well. So
in California.
And
some of you might be wondering, what would benefit me in seeing a registered dietitian? We get that question often. And so I like to say that I really work as a patient advocate. I like to help you all translate all of the health terminology you might all hear. We know that in the traditional system, you might not get as much time with your physician as you would like, or your care team. And there are some out there who are offering extra time. We love, love, love that. We love that the tides are changing. I always want to make sure that when I'm working with a client, with a patient, I have a thorough understanding of their personal health story. There is no one size fits all in nutrition. There is no one size fits all in the healthcare space. So I always love to start my first visit by asking every single person, if you've worked with me before, or if you're curious, I always ask, please tell me your health story. Anything that's happened along the way, diagnoses, illnesses, injuries, any different traumatic life events that you've had.
No one has that, right? None of you guys have trauma and all these horrible things that have happened, whether it's health-wise or in your personal life. No one has that.
James loves making dad jokes. But I really do. I want to know from really womb to tomb people's stories. And if you're coming to me, there's not tomb, and hopefully there won't be for a long time. But really, from the very first day, how is your gut health? What impacted gut health? Whether I'm asking, were you a vaginal delivery or were you a C-section? Were you breastfed or formula fed? We know these things can impact the gut microbiome. I ask, How was your diet as a child? How was your immune system as a child? Were you that kid who was sick often and constantly had bronchitis, tonsillitis? Did you have ear infections chronically? Were you taking antibiotics? Same. How was your diet? Again, what stressors did you have? What happened along your personal journey, and what is your personal health story? So when I work with my clients and my patients, I always like to have that very thorough understanding of their background so I can make personalized recommendations. Of course, there are general recommendations for the population. We all can benefit from eating more fiber, fruits and vegetables, more healthy proteins like legumes, nuts, seeds. We can all benefit from these generalized things. But if you're that person who says, I want to eat those things and I just don't tolerate them well, then we come up with a personalized plan for you. Because even though you might have seen a avoid this list and foods to include for this condition, whether it is SIBO, IBS, inflammatory bowel disease, or IBD, histamine intolerance. I have some patients with things like POTS, mast cell activation syndrome. I have a lot of these patients who have these chronic conditions. SIRS is another one that I see patients for. So again, these general lists that are out there might not be appropriate for each individual. So I like to help each person understand what they're tolerating and what they're not.
Right, because it's not one size fits all, everyone. And you can see all the confusion out there. If you're on Instagram, if you're on Facebook, if you're looking at all these different blogs and websites, and you're seeing like, okay, I can't eat this, I can't eat FODMAPs, I'm not going to eat gluten, I'm not going to do plant-based is horrible, no carnivore is horrible, no paleo is horrible. There's so much confusion out there, guys. So we want to really cut through that. We're partnering with some great people. We are going to be doing a lot of cool projects. A lot of great things are coming up. So when you go to our website, sign up for our newsletter as well. Don't forget to do that because we have a lot of great things. We want to give you guys as much information, as much evidence-based and innovative and really
integrative
that
is
information.
Where it's at. And,
yes.
If you wanted to really get an understanding of how we practice, we always say we're that, really perfect middle ground between, yes, evidence-based, but integrative and forward thinking. So again, just because you might not fit within someone's guidelines or within somebody's box doesn't mean that there is no hope. We always like working with people, and we love to integrate complementary and alternative modalities. So some of our recommendations might include, we recommend you try acupuncture. What about myofascial release? What about massage? What about trying this different herb or this different essential oil or this different supplement? And we're going to integrate that with a nutrition plan for each and every person.
Right. And nutrition, really the nexus of nutrition is gut health. And that's why we love gut health, because really it's all in the gut. And really the gut is not just what you eat, what you're exposed to. So we do get into that environmental aspect as well. So yeah, we try to look at the big picture. We try to look at root causes. We look at why, not just what, right? The what is the symptom. The why is the root of that symptom. What is causing that symptom to be there? That is what is so important. So if you've ever felt like no one's listening to me, I don't know, my providers, we don't know what to do. I don't know what to do. I feel unheard. I feel like I don't have enough time. I feel like I need something more. That's really the gap we're trying to fill. And it's so important because you're not alone. We felt that way when we were going through our health journey. Our family members feel that way. Our friends feel that way. And we've seen hundreds, if not thousands, of patients who felt that way. So we're excited, guys.
I remember being told, you're tired and you don't feel well because you're a mom.
Yeah.
If that's what your provider is telling you, you have not found the right provider. That is not what we should just resolve to say. You feel terribly because you have kids, or you feel terribly because of this or that. You want to figure out ways to thrive, not just stay alive, but to thrive, whether you are a mom, whether you're a student, whether you are older, no matter where you are, you deserve to thrive. And you deserve to have a care team that cares about helping you with that.
I see some questions coming in. Do you want are there some we can answer? We love when you guys give questions. We're going to be doing lives. Again, to the newsletter, we're going to be coming out with a lot of ebooks that are just going to be free. So if you're signed up to our newsletter, you're going to get it first. You're going to hear about it first. So marytalk.com, and you'll see it pop up. Sign up for the newsletter, or you can go to contact us and just shoot us a message. So we'll be sending that. But what question do you have?
And you guys, I know we specialize in gut health. And before I answer these questions, just want to share that not only are we launching really exciting things, and you guys will hear about things more to come. We are partnering up with other really awesome dietitians who specialize in different areas. So once that is all ready to go, we're going to clue you in. We're going to let you know about that. So somebody's asking a question. Do you take clients with diabetes? My dad only speaks Spanish, but I'd love to take him to you. That's a great question. So while I can work with someone with diabetes, because as a dietitian, I understand the process of diabetes, etiology, I can counsel. If dad is having gut issues going on with his diabetes, I'd love to see him. And so I could work with dad. Again, like I said, we're having awesome dietitians join our practice in the next couple of months, one of whom will thoroughly work with clients with diabetes. And so we can figure out how to make that happen. So send us a private message and we can answer that question more thoroughly, but especially those diabetics who are having gut health issues. We just spoke over the weekend at the Diabetes Summit, the E4 Diabetes Summit, and we talked about the connection of gut issues and diabetes. So we always want to help our diabetics prevent any neuropathy in the gut, enteropathy. So we can absolutely figure out how to make that work.
Yes.
And we had another super sweet comment. Everyone should see you guys. Dahlia truly helped change my health around. Thank you. Well, it's an honor to be part of every single person I work with's health journey. And I really do take it seriously. I really do see it as my clients, my patients, and trusting me. It's personal. I ask about your poop. I ask about how your gas smells. I ask, do you have reflux? Are you bloated? We're really getting to know one another. And really your care team should take that time to know that. So I really do appreciate and I really do understand how much of an honor it is for every client to trust me with that health information and to come to me and seek me out and to really want to make those improvements in their health. So thank you. It's been an honor working with.
And we're seeing hearts, we're seeing thank yous, we're seeing all you guys. It's great to be on here. It's so important to guys to connect with communities. So that's what we're going to be doing more. I feel like community is a commodity now in 2020 and now 2021 and beyond. So I'm going to connect more online. Again, we're going to have some great things. We'll be coming on live more often to talk about topics. So we will just want to talk with you guys and talk about specific topics. So if you want to learn if you want to learn more about SIBO, if you want to learn more about IBS, if you want to learn more about GERD and reflux and pediatric gut health, those are things we're going to be talking about. So stay tuned. Again, you can subscribe to our newsletter to learn more. And we're excited. We are really excited for 2021. We want to spread this love, spread this community, and spread that connection to this important education. So wonderful, guys. We'll see you all very, very soon.
Hi, Magdi.
Yeah, what's up, guys? Cool.
If you have any questions, you all can message us. Again, we can't answer any medical questions, any personalized medical questions, but if you have any general questions, we always love hearing them. Topics that you suggest that you'd want to see us going live on, we would love to hear about it. We've been away from social media for the last several months, but we are back, you guys. We are back. We're going to make it better than ever. We have some amazing content coming out, and we're going to be going live more with each other and with others.
And to comment on that, it's important to step away. This is all about balance, guys. Success is not just measured in number of followers and how much money you're making. It's successful marriage, it's successful family with your kids and with your health and with your environment. There's many, many layers to success. So this might happen again. We need to step away. We go away for a little bit. We're totally fine with that. It's all about that balance. And that's something we want to bring to you guys. Because if we're not practicing what we preach, what's the whole point, right? We're posers or fakes. So it's all about practicing what we preach with us. So yeah, we're excited, guys.
Yes.
Wonderful. Have a beautiful weekend, everybody. We'll be back very soon. Stay tuned. And we will talk to you later.
Bye.
Bye, everybody.